You are 19 years old. You told your parents you want to be a dentist. They smiled. They were proud. They had no idea what they just agreed to. Neither did you. Level 1, the dental student. Your first day of dental school, you walk in thinking you're about to become a doctor. You are handed a plastic skull. Her name is Denise. She will haunt you. You spend the next 6 months drilling teeth on Denise while your friends from high school are at parties, on road trips, living their lives. You are memorizing the 32 bones of the skull at 2 a.m. eating cold rice. The coursework is not hard. It's impossible. Biochemistry, dental anatomy, histology, physiology, microbiology, pharmacology, occlusion, radiology. All at the same time. You fail your first practical exam. Not because you didn't study, because your hands shook. You learn to place your first composite filling in a lab. It takes you 4 hours. It looks like a melted crayon. Your professor looks at it, looks at you, walks away without saying anything. That silence is your grade. You survived year 1, barely. You have spent $0 and lost 12 pounds. But then you enter the clinic, and everything changes. Your first real patient sits down in the chair and looks at you, actually looks at you, expecting you to fix something inside their mouth. You are 21 years old. You have never felt more powerful and more terrified in the same moment. Your hands are shaking again. But this time, you don't stop. Level 2, the dental intern. You graduated. There was a ceremony. There were photos. Your mom cried. And then Monday came. You are now an intern, which means you are a dentist, in theory. In reality, you are the lowest organism in the entire hospital food chain. Lower than the receptionist, lower than the sterilization tech, possibly lower than the mop. Your attending walks up to your first patient, looks at the x-ray, looks at the tooth, then looks at you. What's your treatment plan? You open your mouth. Nothing comes out. Not because you don't know the answer, because there are 6 possible answers, and one wrong one will put you in front of a disciplinary board. You give the answer. He nods, walks away. That's the entire feedback you get for the next 3 months. You are now doing everything: extractions, fillings, scaling, root canals, on real people, with real pain and real consequences. And you are getting paid almost nothing. You drive a 2009 Honda Civic with a cracked windshield. You eat lunch at 4 p.m. You wear the same white coat every day and convince yourself it builds character. But then one day, one ordinary Tuesday afternoon, you do a full extraction, clean, no complications. Patient gets up, looks at you and says, "Thank you, doctor." Doctor. They called you doctor. And for a few seconds, the Honda Civic doesn't matter. Level 3, the junior resident. You matched into residency. You want a specific specialty. Maybe periodontics, maybe endodontics, maybe oral surgery. You're not there yet, but you can see it from here. You are no longer just performing procedures. You are teaching interns how to perform procedures, while an attending supervises you, while a patient is in the chair, while your pager goes off. All at the same time. You stop sleeping like a human being. You sleep like a machine that needs to reboot for 4 hours or it crashes. You see a complicated case, a patient with uncontrolled diabetes, hypertension, and a severely infected molar that needs to come out now. You have to medically manage the patient, communicate with their physician, plan the extraction, and document everything perfectly. One mistake in any of those steps is a lawsuit. You are 26 years old and you carry that weight every single day. But you are also learning at a speed that is almost violent. Every week you can do something you couldn't do the week before. Every month you are a different clinician. You start to feel the outline of who you're becoming. And that feeling is addictive. Level 4, the senior resident. Now things get interesting. You are the one people call. You are the one who walks into a room when things go wrong. When the intern panics, when the case turns complicated, when the attending isn't immediately available, they call you. That is terrifying, and it is the best feeling you have ever experienced. You are now performing complex procedures with your eyes half open and your hands fully steady. Bone grafts, surgical extractions, deep tissue periodontal work, implant placements, root end surgeries. You are not pretending anymore. You are legitimately dangerous in the best way possible. But the program is almost over, and now you have a decision to make. Do you go into private practice and start making real money? Or do you push further, harder, longer? Do you go for the specialty? Some of your colleagues tap out here. They open clinics. They buy houses. They have weekends. You respect them, but something in you isn't done yet. You stay in the game. And this, right here, is where the real levels begin. Level 5, the general dentist. You open your own practice, or you buy into one, or you join a group. But either way, You are now a real dentist in the real world, with real rent, real staff, real overhead. And nobody prepared you for this part. Dental school taught you how to fix teeth. It did not teach you how to manage 6 employees, handle insurance billing, market your practice, deal with a receptionist who called in sick on your busiest day, and still perform a perfect crown prep at 9 a.m. Your first year is chaos. You are seeing 15 patients a day and somehow still losing money because your lab bills are too high and your insurance reimbursements are insulting. You have a patient who screams at you because their crown doesn't match the shade of their other teeth. You have a patient who disputes a bill. You have a patient who posts a 1-star review because they didn't like the parking. This is the job. But then, month 8, you turn a profit. Month 14, you hire your second hygienist. Year 3, you renovate the office. Year 5, you are making more money than everyone you went to school with who chose a safer career. You pull into work on a Tuesday morning. Your name is on the door. Patients trust you with their health. Your staff respects you. You built this. This is a good life. A great life, honestly. But some people reading this, some of you, aren't general dentists. Some of you went back. Level 6, the specialist. Orthodontist, periodontist, endodontist, pediatric dentist, prostodontist. You picked one, and you went back into training for it. 2 to 3 more years, more exams, more boards, more sacrifice. But now you are the person that general dentists call. When a case is too complex, when the patient is too complicated, when the treatment requires a level of precision that goes beyond what a general practice can offer, your name is in that referral. You are the expert. Your waiting list is 8 weeks long. Your fees are not negotiable. Your opinion carries weight in ways that only specialists understand. You live well. You work fewer hours than your general dentist counterparts. You have mastered your corner of the human body so completely that procedures that would take others hours take you 45 minutes. You know things. And people pay for what you know. If you're enjoying this story, this journey through the grind, the sacrifice, the wins, subscribe right now. Because we tell stories like this every single week, and you do not want to miss what's coming next. Back to the story, because we still have one level left. The final one, the boss. Final level, the oral and maxillofacial surgeon. This is not a dental specialty. This is a different world entirely. To get here, you went to dental school. Then you went to medical school. Then you did a surgical residency. Then you completed hospital rotations in anesthesia, plastic surgery, trauma surgery, and oncology. By the time you are done training, you are somewhere between 32 and 35 years old, and you have more degrees, more licenses, and more board certifications than almost anyone in any room you walk into. You are a dentist, and a physician, and a surgeon. All 3 at the same time. Your operating room is not a dental chair. It's an actual operating room, with an anesthesiologist, with surgical nurses, with a scrub tech, with beeping monitors and sterile drapes, and a patient who is completely unconscious and trusting you, only you, to bring them back out safely. You reconstruct faces. You remove tumors from jaws. You rebuild orbits. You correct skeletal deformities that have made people unable to eat, breathe, or speak correctly their entire lives. You replant teeth knocked out in trauma. You do cleft palate repairs on children. You manage facial fractures from car accidents, gunshot wounds, industrial injuries. You do what no one else in the building is trained to do. When a patient comes into the emergency room with a broken jaw at 3 a.m. on a Saturday, who do they call? You. When an oncologist needs a vascularized free flap to reconstruct a jaw after cancer resection, who do they call? You. When a child is born with a face that needs to be rebuilt in stages over the first 20 years of their life, who do they call? You. Your hands are the most educated hands in the hospital, and when you walk into a room, surgeons, physicians, residents, nurses, they all know it. The money is real. The respect is earned. The stakes are as high as stakes get in clinical medicine. But here is what nobody talks about. You carry your patients differently than other people carry theirs, because you have held someone's face in your hands, literally, and made a decision in real time that changed the shape of their life forever. You have sat in a scrub room at 1 a.m. after an 8-hour reconstructive surgery and stared at the wall trying to process what you just did. Not because it went wrong, because it went right. And somewhere in that moment, you understand why you did all of it. The 19-year-old with the plastic skull, the intern with the cracked windshield, the senior resident who never slept, the years nobody saw, the sacrifice nobody clapped for. Every level led to this room. Every exam, every failure, every shaking hand, every silent professor, every 4 a.m. study session. It was all this. It was always this. You walk out of the hospital. The sun is coming up. You've been here since yesterday. You are exhausted in a way that most people will never understand. And you would do every single second of it again.